72-year-old Chuchi Haspela travels from Westchester to meet her Filipino friends for dinner here in Queens. They have all gotten the COVID-19 vaccine. She will not.
Maybe planning to have that vaccine in later years, or not at all.
A study by the Filipino consulate in Hawaii found that Filipinos in the US are among the least likely to be vaccinated. At the dinner table, Haspela's friend, Novin Blancaflor, a healthcare worker, tells her he's worried about her.
Having vaccinated is not a guarantee that you will not get sick.
But
however, you have in yourself the peace of mind that you are protected.
It has been reported before na grabe ang toxicity ng vaccine sa tao. It's not just kay it will be a long-term effect, hambal nila.
The Filipino vaccine hesitancy in the US is connected to the same feeling back home. In the Philippines, only about 12% of Filipinos have been vaccinated, according to the number of doses administered. Public health experts say part of the reason for the hesitancy is tied to a different vaccine controversy. This one centering on Dengvaxia, a vaccine which protects against dengue fever, a mosquito-borne illness common in the tropics. Back in 2016, Dengvaxia was tied to several deaths. In reality, the vaccine wasn't to blame, but the rumors still persist on social media. Filipino President Rodrigo Duterte has also played a part in vaccine hesitancy. Earlier this year, he took the Sinovac vaccine for COVID-19, then advised his citizens against it, telling them there are no studies and it might not be good for the body, according to the government's news agency. Here in the US, most Filipinos were born and raised in their home country, holding the same values and having strong connections with people who are still in the Philippines. Dr. Alma Trinidad, a Filipino and professor at Portland State University, says mistrust is rampant among Filipinos back home and, as a result, here in the US.
Because the perception is like, oh, it's still not proven. There hasn't been enough research on the impact of the vaccine on our people.
Dr. Gloria, a Filipino and professor at Hawaii Pacific University, is trying to personally reassure the community. He got a $15,000 grant from Pfizer to do just that.
To do whatever it takes to get them to get the vaccine. And so that means working directly with communities, community leaders, influencers, the VIPs, the gatekeepers, the people who these communities trust.
Now, the Filipino president has been advising his citizens to get the vaccine. In New York, Governor Cuomo announced $15 million to fight vaccine hesitancy. The money is being distributed to community-based groups who are encouraging people to get the shots. Haspela intends to wait for a study on the long-term impact of the COVID vaccine.
Pag nagkaroon ng magandang report about this vaccine, then perhaps I am willing to have that vaccine also. But not now.
For CJS News, Fisayo, Okare in Queens.